So this next video then we're going to look at Unit 8, which is Health, Safety and Wellbeing in Care Settings. Again, this is a combined unit, so we're going to use a range of evidence. There's going to be observations from your assessor, there's going to be some questions and answers, and we are going to look at using any prior learning that you may have had, so any training certificate that you've perhaps already got, and look at what impact that learning has had on your work practice already. So we're going to use this video to gather a range of evidence for Unit 8, Health, Safety and Wellbeing in Care Settings. So the reason we've asked you to gather those certificates is purely to look at the learning or the experiences you may have already had. So what we're going to do is ask you to reflect on those learning experiences, look at the impact that learning has had on your work practice, and you can therefore say by reflection you've learnt something from doing so. So we're not asking you to re-answer the questions, we're saying we're going to use that learning you've already had to say you now understand that learning outcome as a result of that prior learning by reflecting on what you've learnt and looking at the impact it's had on your work practice. So get as many of those certificates as you can as possible, speak to your assessor, get them to send you a reflective log and reflect on what you've learnt and the impact it's had on your work practice. That will narrow down a lot of the work you have to do for this unit. (1.1), 1.2 and 1.3 you may be able to cover all within one answer or using the prior learning. So what you need to do is identify the legislation that relates to health and safety. So go onto the HSE website, that's the Health and Safety Executive website, and look at the health and safety legislation that's relevant to your work role and write about them. Give some definition as to what those legislations mean in your work practice. Within your workplace or your organisation, there should be a displayed HSE poster. It's normally a red and white poster that legally your employer has to display. And on that poster it'll tell you the health and safety responsibilities of yourself, the employer and anyone else in that work setting. So use that poster as a work product to be able to answer 1.2 and 1.3. So to cover that then, to meet 1.1, 1.2 and 1.3, look at whether you've got any previous health and safety training, get that certificate. Go on the HSE website and write about the legislations relevant to your work role and get that poster in your work practice and look at your responsibilities of you, your employer and anyone else, and again write about it, and that'll cover those 3 assessment criteria. 1.4 then is asking us to identify specific tasks within the workplace that we know we can't do without additional training. So think about your work practice, think about what you require training in order to do. So for example, we know we're not able to handle food without food hygiene training. We know we can't use a hoist without specific moving and handling training. We know that we're not able to administer medication without safe handling of meds training. So think about your work practice, think about what specific tasks you're unable to do unless you've had training to do so. Then think about that training, and if you required additional training, where would you go and who would you ask? What policies might you need to read? Would you need to fill out a training request form in order to get that training approved by your manager? Would you speak to your manager in that supervision to request additional training? Or would you speak to your senior on duty to let them know that you're not perhaps confident with a task? So for 1.4, tell me the tasks you need training for, and 1.5, who you'd go to when you need to ask for additional training and why. For 2.1 and 2.2 then, all you have to do is explain why it's important to assess health and safety risks. So what's the purpose of a risk assessment in your work setting? What do they do? Well, we would hope that they reduce or prevent risks that's been identified. So explain the purpose of a risk assessment and why we assess a person's health, safety and well-being. In relation to that care plan, what's the purpose of it? What are we expecting to do? Then tell me how you'd report any particular health and safety concerns in your work practice. So you may have a maintenance file that you complete. So if there's any particular light fitting or light bulb that needs addressing. There may be a trip hazard that needs some urgent attention that you document in a maintenance file for your maintenance man to then sort out. So tell me why it's important to assess health and safety needs and to risk assess to reduce them risks, and then tell me the process in your work practice for reporting health and safety concerns. Who do you go to? What do you fill out? That's what I need to know. So in the previous slide then, I've given you the 5-step risk assessment process, and 2.3 asks you to look at the process for reducing risks and managing conflict between an individual's rights and health and safety. So we know that an individual has got a right to make decisions for themselves, and they may at times put themselves at what we deem to be a risk. But a risk assessment allows us to manage that risk, eliminate it, and sometimes prevent that risk from occurring. So explain to me, what's the process of a risk assessment and how does it help to reduce risk, prevent risks, and allow an individual to make positive risks whilst managing health and safety? So 3.1 and 3.2 ask you to describe the accidents, incidents or sudden illness that can occur in your work setting, and then explain the procedure you'd follow should they occur. So to meet 3.1, just give a load of examples of what may occur in your work setting, like burns, like scalds, like electrocution, like a fall, a trip, a slip. Yeah, it may be that they have a stroke, they may go into a diabetic coma, they may have a heart attack. So think about both the accidents, incidents and sudden illness that can occur within the work setting and give examples of those. And then for 3.2, if they do occur, what's the procedure you follow? Now you may have already got some first aid training that you understand the procedure in which you follow. Write about it. If not, get your first aid procedure, get your accident incident procedure, and tell me what you do in a non-emergency and an emergency situation, who you'd contact, who are the people you need to report to, what documents do we need to complete. So I need to know what procedure you would follow in the event of an accident, incident or sudden illness in your own work setting. 4.1 and 4.2 is looking at infection control. Now previously I asked you to get your infection control certificate, whereby your assessor may ask you to reflect on what you've learnt by doing that training, if you've done that training. Now if you haven't, you have to answer 4.1 and 4.2. So grab a copy of your internal infection control policy and have a look at what your policy says your responsibilities are and that of your employer. So what are your responsibilities in relation to infection, prevention and control? So give me some examples about what you do in your own work practice to prevent the spread of infection and what your employer must do in order to comply with infection control procedures and measures within the work setting. Yeah, so you're looking at you as an employee and them as an employer. Then in 4.2 you have to look at what are the causes and the spread of infection. So do a bit of research and look at what may cause the spread of infection within your own work setting and write about them. So a couple of things to consider here then. Have you got a training certificate for infection control? Have you reflected on that learning? If so, you can still answer 4.1 and 4.2 as additional evidence. If you don't have that training certificate, answer 4.1 and 4.2 and consider what I've just said using your own internal infection control policy. 5.1 asks you to identify the legislation that relates to moving and handling. So in the previous slide I've put a link to the HSE website. What you need to do is go onto that website and have a look at all the legislation that relates to moving and handling it and write about it. You can identify them, but to meet the overall learning outcome you have to show an understanding of them. So look at what each legislation means to you in your work practice and what procedures must we follow in relation to those. So 6.1 and 6.2 then, you may have done some COSH, which is Control of Substances Hazardous to Health training. Get that certificate and reflect on that learning and look at what you've been taught or what you've learnt from doing that COSH training. Secondly, answer 6.1 and 6.2. What you need to look at is the hazardous substances that are available or materials that are in your work setting that are particularly hazardous or harmful to you or someone else. Don't just think about chemicals and cleaning products. Think about the bodily fluids as well that you may come into contact with, and give a list of and give examples of those hazardous substances and materials that are particularly harmful. Then what you need to do is look at the ways you store, handle and dispose of those particular substances. What I would advise is get your COSH data sheet. So speak to your cleaner. They're probably very much aware of where those data sheets are, and what they are, they're a data sheet or a record of how to safely use the chemicals, how to store them safely, what particular instructions you must follow, what manufacturer's guidelines you must adhere to, how to safely use them and how to safely dispose of them. So that COSH data sheet would give you an idea of all the chemicals you use, all the hazardous substances you use in your work practice, and what recommendations you must follow. So for 6.1, identify those hazardous substances and materials. 6.2, tell me how you handle them, how you dispose of them, and how you store them safely in line with your own work practices and your own COSH policy and procedure. For 7.1, 7.2 and 7.3 then, I would expect you to have already done some fire safety training. That's a minimum requirement as part of the induction standards. As part of that care certificate, you'll have had to have done some fire safety training. So get a copy of that certificate for your assessor and reflect on what you've learnt. Reflect on how you now know how fires are prevented and how fires are started. Look at that learning, what's taken place as a result of doing that fire safety training, and reflect on what you've learnt. Reflect on how you now know the evacuation procedures and how to raise the alarm and what to do in the event of a fire. Think about those emergency procedures and explain what those procedures are in the event of a fire. So what I want you to do is look at your fire safety training, look at what you've learned, reflect on that, and tell me what you now know as a direct result of doing that training. And that should meet 7.1, 7.2 and 7.3. 8.3, what you have to do is explain why it's important for everyone else to know your whereabouts, particularly in your own work setting. So why do people need to know where you are at any point whilst you're at work? It's not only to comply with your health and safety policy, it's to safeguard you, it's to safeguard your vulnerability and to prevent any potential harm coming to you whilst at work. If people know where you are, you're accounted for in the event of a fire. It also safeguards the home because we have to prove that there's a certain ratio of staff to service users. So knowing where you are at any one time, in the event of a fire, in the event that something goes wrong, gives great evidence and safeguards you and the home. So what you need to do is explain why it's important that staff, if you go out for a break, should you leave for your lunch, know where you are. It may be that they're relying on you to help with an incident, and if they don't know where you are and not able to summon help, that incident's going to be prolonged into it, and it could cause unnecessary harm or injury. So why is it important that staff on shift know where you are, explain the reasons, and look at not just health and safety, look at what could go wrong in your work setting if they didn't know where you were.